Welcome, and thank you all for attending our first speaker program of 2019. We have a full house today. There were about 50 people registered to attend in person, and I think we have about 75 to 80 people listening live online. So thank you all for being here, and I always tell Elaine Cole and Janice Meinert, our speakers, they draw a crowd. So we are, and we keep bringing them back, and they keep coming back, and you know, session after session. This topic is something that our readers and families that we work with tell us over and over, this is something they want to keep hearing about. They want to keep knowing what's new with Social Security, what's new with Medicare, Medicaid, MAWD, and waivers. So I'm not surprised about this, but I'm really glad you're all here. First of all, just a couple of topics. We're back on the other side of this wall, so you can actually go out either door and go to the left, to the right up here, and the restrooms are right there. So if you need to leave, no problem. There is coffee and bagels and muffins in the back of the room, so you help yourself. I know, I'll let the speakers introduce themselves, but I know that there are materials on the front table. Did everyone get a copy of the slides on Medicare, Medicaid, MAWD, and waivers? The slides? Okay, so I want to make sure everyone has that. And I also handed out a couple of minutes ago a survey to everyone. On one side, it's for parents. On the other side, it's if you're a service provider. And I just ask you to fill those out at the end of the program. We are able to do these speaker programs because of a generous grant that we have from United Way of Southwestern Pennsylvania. And they really, the grant and the work we do with the United Way really enables us to host these programs, to go out in the community, to meet with families, and to help you in whatever way we can. So we appreciate your feedback, and it's just a way for us to see what we can do better or what else you need from us. So I appreciate at the end, I will collect those. And it looks like Janice is going to go first. So again, we have Janice Meinert from Pennsylvania Health Law Project and Elaine Cole from Social Security Administration. So Janice, if you want to go ahead. Thank you. Thank you.
Good morning, everybody. Thank you, Patty. So I am Janice Meinert. I'm with the Pennsylvania Health Law Project. I have a lot to try to cover in a short period of time. So I think I'm going to try to move through all the material and save the questions towards the end, just because I think that's the only way I'm probably going to get through all of this. And then if folks are not familiar with the Health Law Project, please talk to me afterwards, because again, I feel like there's so much material to go through that I want to kind of just dive right into that. But if people aren't familiar with us and who we are, what we do, how we can, what kind of services we provide to people, certainly, everything that I'm going to talk about, in this hour is all tied to the work we do and our areas of expertise. So, any issues, questions, problems that you have that might be related to, this is really the heart of what we do in terms of our direct client work. So, any problems or individual issues people are having, having to do with any of, the public health insurance programs, Medicaid in particular, medical assistance, the Medicaid waivers, community health choices, that's what we do. Those are our areas of expertise. And I think at the very end of I think my presentation, I have our helpline number. In addition, you have my direct email and my direct phone number. So don't hesitate to use it. Okay. So we're going to cover all of these things kind of in a fairly cursory way, because we could spend 2 hours on almost any one of these topics. Maybe not MAWD, but the rest we certainly can and often do spend 2 hours just on any one of these topics. So we're going to kind of look at each of these areas more broadly. So we're going to start with Medicare and just some of the basics about Medicare. Oftentimes folks think that Medicare is just that health insurance that people get when they turn 65, and that certainly is a part of, what Medicare is. It's a federal health insurance program. People work, pay into it, turn 65, they can start to, get that Medicare coverage, and we'll talk more about, exactly what that looks like. But people can also get Medicare after they've been determined disabled by the Social Security Administration, maybe not Elaine personally, but her administration, and Elaine's going to tell us more about what that looks like and that process. But once Social Security has determined somebody is disabled and eligible for Social Security disability insurance, which is not the same as SSI, Supplemental Security Insurance. Again, Elaine's going to tell us more. But once somebody's getting this particular benefit, SSDI, get that benefit for 2 years, then they become Medicare eligible. So, you know, that could be a 30-year-old. You know, that in this case, the Medicare is not tied to a person's age. It's tied to their work history, being determined disabled, and 2 years following that, then they're Medicare eligible. And people can also be eligible for Medicare if they have a diagnosis of end-stage renal disease and are receiving dialysis or have had a kidney transplant. So, you know, those are the different ways people can become eligible and actually be on Medicare. So Medicare has really 4 pieces to it: Medicare Part A, B, C, and D. A is the hospital coverage. That's the part of Medicare that generally, and always the exceptions, but generally if you've become disabled from Social Security 2 years and then get Medicare, or you work, pay into, turn 65 and get Medicare, the Medicare Part A is premium free. Part A is your hospital coverage. It just has to do with covering, you know, any care you get in the hospital as an, you know, admitted as an inpatient to the hospital. Medicare Part B is the medical insurance. It's the basically everything outside of hospital care, so doctors and tests and x-rays and, you know, any of those, you know, kinds of things, therapies, that, you know, physical therapy, behavioral health therapy, those things all fall under Medicare Part B, as in boy. Medicare Part C is our Medicare Advantage plans and a way that people can get their Medicare benefit instead of just directly through Medicare with a Medicare card. People could have Medicare through a Medicare Advantage plan. And then Medicare Part D is the drug coverage. So different ways that people, you know, might have their Medicare coverage. And that alone can make it confusing just if you're talking to a friend, a relative, whoever, you know, the way you have your Medicare and what your needs might be tied to your insurance and your health care, you know, could look different, you know. So I might be going to the doctor's office with having just Medicare A, B, and D. In that case, I'm giving the doctors that red, white, and blue Medicare card. Somebody else might have Medicare through a health plan, through a Medicare Advantage plan. That's the card you're giving to the doctor. That's who the doctor is billing directly, that health plan that Medicare has contracted with and approved to provide you with your Medicare benefits. So, again, I think we touched on some of this, you know, in terms of, you know, how do people enroll in Medicare. If somebody is not receiving Social Security benefits when they turn 65, then they have to actively enroll in Medicare to, you know, to begin getting that coverage. Sometimes people don't need to do that because they're still working. They still have insurance through that job or through a spouse's job, so they may delay enrollment in Medicare. You enroll in Medicare through Social Security. Can't explain why. Maybe later Elaine can. But again, I do think it adds to, you know, just the confusion of all of it. So I want to enroll in Medicare, or I call Social Security. Why is that? Don't know, but that's how it works. So, you know, again, it can, that alone can make it, you know, confusing. If somebody doesn't enroll in Medicare A, and in particular Medicare Part B, when they are eligible, and delay enrollment in Medicare Part B, you can end up with penalty, meaning it costs when you do enroll, and you then can't necessarily enroll anytime you want. So again, really, the Medicare and You handbook that people get, once they're eligible for Medicare, it's long. It's one of those things that probably 99.9% of us would get and go, oh, yeah, I'll put this somewhere. So, maybe in case I need it. There are some really important things in that book, like, if you delay enrollment in Medicare Part D, it's really important to know whether or not there could be consequences for that later. So what is Medicare Part D? And Medicare Part D is what's often referred to as Medicare Advantage plans. They are health insurance plans that contract with the Center for Medicare and Medicaid. And in that contract, they are then guaranteeing that they will provide you at a minimum what you would get if you just had Medicare through the Center for Medicare, your Medicare Part A and Part B. And many people, especially people who aren't low income, people who are low income can qualify for Medicaid, and we're going to get to that, in addition to Medicare. And those folks don't necessarily need to enroll in a Medicare Advantage plan. People enroll in a Medicare Part C, a Medicare Advantage plan, because Medicare Part A and B and D even alone don't cover 100% of care. So that's one of the benefits and one of the reasons why people enroll in a Medicare Advantage plan. And that Medicare Advantage plan could cost everything anywhere from nothing. There could be a zero monthly premium, and as most of us expect, we get what we pay for. So if you've got a Medicare Advantage plan with no monthly premium, it's not going to be covering likely much more than just Medicare A and B does versus a Medicare Advantage plan that you're paying $180 a month for. I would expect if I'm paying $180 a month for a Medicare Advantage plan that it's covering more than just Part A and Part B does by itself. And Part B in particular covers 80% of care. So it can be really helpful for people to have those Medicare Advantage plans that are generally then helping to pay for more than 80% of every time I see a doctor, a specialist, have a test, have an x-ray. All of that's just covered at 80% if I just have that Medicare Part B. But again, the Medicare Advantage plans have to cover at least what I would get if I had just Medicare, with Medicare Part A and B. The Medicare Advantage plans can also include the prescription drug coverage. Often they do. Sometimes people might have drug coverage through, an employer or through a spouse's employer. So they may or may not need to have and pay what would likely be a little more money for a Medicare Advantage plan that also covers the prescriptions. So it's so very individualized when it comes to making these decisions. And in Pennsylvania, we have an organization called the Apprise Program, whose expertise is strictly in Medicare. They are free Medicare counselors that really help people navigate all of this. They have no investment in any of these health plans that might sell Medicare products. It's strictly their job to, help people understand all of this and then look at what your individual circumstance is, and what your needs might be, at least in any given year, where, for most people you have an opportunity to change your coverage at least once a year. Some people even more frequently than that, depending on some other factors. So again, Medicare Part D is the drug coverage. People can get their Medicare Part D coverage, one of two ways. Through what's considered just a standalone Part D drug plan. What's different about Medicare Part D than Medicare A and B is that the only way to get Part D drug coverage is through an insurance company. As opposed to Medicare Part A and B, I can have that insurance directly through the Center for Medicare. The Center for Medicare does not provide Part D drug coverage. I mean, Medicare covers drug coverage, but I can't get it, directly. I can't just call the Center for Medicare and say, okay, I'm eligible. I want to, I want Medicare Part D. The only way to get Medicare Part D is through an insurance company. But there's one of two ways to do that. So your Medicare Part D coverage can be through just Part D drug plan. So it's just what I use to get medications, almost always at the pharmacy, maybe mail order. But that card is, just what I'm using to get just prescriptions. Or, as we talked about earlier, you could have your Medicare Part D coverage a part of your Medicare Advantage plan, where that Medicare Advantage plan is covering and including your Part A hospital coverage, your Part B doctor outpatient coverage, and your Part D drug coverage. So again, it can be very individualized in terms of, what somebody's needs are, what providers you want to access, what providers are in the network of, of any particular Medicare Advantage plan. Do I need drug coverage right now? Again, maybe I don't. Maybe I'm still working and I have good insurance that includes drug coverage. Then I can delay Part D. I don't even need it. And certainly if I have to pay for it, why would I do that? But lots of really important rules. Again, we could spend 2 hours just on Medicare, around if I don't enroll in Medicare Part B or Medicare Part D drug coverage, when I'm eligible, might there be problems by delaying it? So really, again, nuances we don't have time to get into today, but important information to know, that anytime somebody calls us and they've delayed enrollment in Part B in particular, my heart always sinks because the person I'm talking to is clearly not expecting me to say, you missed your open enrollment period, and now you can't enroll in Medicare. People call in August. They've missed their open enrollment period for Medicare Part B. They can't enroll in Part B until the following January through March, and that coverage doesn't begin until July 1. So that person who's called me in August of last year, and there are exceptions, but if they don't fit an exception, they're going without that Part B and generally then without any doctor outpatient coverage until that following July 1. So, it's just really important that, that people are kind of paying attention and keying into, all of the kind of the nuances of these rules. And again, these are the kinds of things you call our helpline that we can help you with, and the Apprise program has lots of expertise in. Okay, so we're gonna move into Medicaid. That was your Medicare 101 basics, as basic as as we can get in in a short time frame. So let's talk now some about Medicaid. Medicare and Medicaid, two totally different insurances. And again, the world of insurance, not the world, at least for us in this country, is so confusing that we talk to people all the time that aren't even clear about what insurance they have. Or they say they have Medicaid, and when we drill down, they don't. They have Medicare. Or they think that they have Medicare, and in fact they have Medicaid. So two totally different insurances. Medicaid is a federally state-funded program. Medicare is strictly federal dollars, a federal program. States can't do anything, by and large, to impact the Medicare program. Medicaid is different. Medicaid is a joint-funded, jointly run health insurance program from the federal government, that same entity, the Center for Medicare and Medicaid Services, and the state government. And it's funded in Pennsylvania. It's pretty close to 50-cent match, you know, for every person on Medicaid. Pennsylvania's got to come up with about 50 cents on the dollar of the cost. The federal government's funding, you know, the other 50 cents. We call Medicaid in Pennsylvania medical assistance. Again, just why? I don't know. We just add to the confusion. I think we should just call Medicaid Medicaid. But lots of states have their own name for their Medicaid program, and we do as well. So, you know, when people talk about Medicaid or medical assistance in Pennsylvania, we're talking about the exact same thing, just has two different names. In Pennsylvania, that program is managed by the Pennsylvania Department of Human Services, what used to be called the Department of Public Welfare. So if people think of it, you know, as, you know, but I thought it was the Department of Public Welfare, well, it was. It's, in the last couple of years, changed its name to the Department of Human Services. So Medicaid is health insurance generally for people who are lower income. But in order for anybody to get Medicaid, you have to first fit a category of eligibility. And then within that category, there can be different income limits. Some of those categories also have resource limits in addition to income guidelines. Some don't. So again, it's a very nuanced, very kind of complicated program. People can also have Medicaid in addition to Medicare. Because again, remembering there's two very separate programs with different eligibility criteria. So I may be eligible for Medicare and also eligible for Medicaid. And the combination of the two are actually very, very good insurance, very good coverage when you have both. When people have Medicaid in addition to any other insurance or insurances, occasionally we see people that have three insurances, one of which is Medicaid. Medicaid's always the payer of last resort. So whatever other insurance you have, any service you're trying to access that other insurance covers, you have to be, I always say to people, like, that one's driving the train. We've got to pay attention to what's the insurance, you know, what's that other insurance you have if you have something other than Medicaid, you know, because if what you're trying to get is covered by that other insurance, we got to be focusing as much or more on that other insurance as the Medicaid piece, because you can't just disregard that primary insurance because it's a hassle to work with, or, you know, the network is limited, or it just simply doesn't work that way. You can't bypass your primary insurance and just try to access the care you or your loved one needs under Medicaid. It just doesn't, unfortunately, work that way, even though it would be easier sometimes if it did. So basic Medicaid eligibility, you know, kind of basics. People have to meet certain citizenship requirements, have to be considered a resident of Pennsylvania. For Pennsylvania's rules, that just means I am here with the intent to stay here. So I don't have to show that I've been in Pennsylvania X number of days. I just have to show that I'm here with the intent to stay here. And wherever I'm staying at that particular time, then have some, you know, some verification, you know, even if it's, you know, just a letter from my sister that says, you know, my sister Janice Meinert is currently living with me, and then you would probably give me something, you know, verifying your address that I would use to show I'm here now. You know, I don't have my own permanent residence perhaps, but I'm here with the intent to stay, and for right now I'm staying with my sister. Again, have to fit into a category and then meet the income and resource guidelines for that category. So we're going to talk about, you know, some of those categories. The Medicaid categories, and again, this gets into a level of detail that we won't need to get into today, but generally, you know, Medicaid now falls into what's considered the MAGI categories. Modified Adjusted Gross Income is what MAGI stands for, or the non-MAGI categories. The MAGI categories came from the Affordable Care Act. The Affordable Care Act was a very, very large bill that provided all kinds of benefits to, you know, lots of us across the country, and many people often don't realize that. One of the things that the Affordable Care Act did was allow every state, if they chose, to expand their Medicaid programs to cover more people, in particular adults, who were often the ones uninsured. And so that's where this whole MAGI piece came from, you know, several years now since the implementation of the Affordable Care Act. So, and people who fall into that MAGI category, that particular category has no resource limit. That category is looking just at who's in the household, who may be filing taxes, who's claiming who as a dependent, or who's being claimed as a dependent. And that's how we're looking at, you know, who's actually in the household and what's the income there. That's going to help determine whether I'm eligible, you know, under that category. And then there are, and that's not even an exclusive list, but some of the more common other categories of how somebody qualifies for Medicaid. So when people call our helpline and they're uninsured and they're, you know, obviously trying to find coverage, you know, the first thing that we always screen people for is, might this person that I'm talking to be eligible for Medicaid? And so I'm starting to ask questions to try to, you know, ascertain, does somebody fit a category? And then from that category, look at the other things that might matter in that category, like income, often resources as well. So, you know, I'm keying into some of those, you know, what's your age? Because 65 and older automatically puts you in a category. That is a category. Seniors, people 65 and older meet a category of Medicaid. You know, is the person pregnant? Does the person have a disability? Is this a woman with breast or cervical cancer? You know, those are the kinds of things I'm asking people to try to ascertain, do they fit a category of Medicaid eligibility. This expansion that the Affordable Care Act allowed for and Pennsylvania adopted under Governor Wolf really helped open up the possibility. These were the folks, you know, 19 to 64-year-olds without disabilities, who were not parents in particular. That's the group of folks that primarily went without insurance. Now we have about 700,000 people in Pennsylvania that fall into that category who have health insurance because of the Affordable Care Act and because Pennsylvania chose to expand their Medicaid program. So medical assistance for Medicaid eligibility for kids. Kids can actually qualify for Medicaid in three different ways. If the child's eligible for a Social Security benefit, an SSI benefit, Supplemental Security Income, and this is true for adults, it's true for anybody. If I've been determined disabled by Social Security such that I'm getting an SSI check, not an SSDI, an SSI check, then I automatically get Medicaid. I don't even need to apply. They go hand in hand. Social Security determines I or my child is eligible for SSI. My check might be $500. Your check might be the full amount of $771. My check might be $12. As long as I am determined eligible and getting a check from Social Security, an SSI check, then I automatically have Medicaid. Social Security is going to communicate that to the Department of Human Services, to the county assistance offices, and they're going to put me on to Medicaid, and they're then going to send me the information about Medicaid and my Medicaid health plans, and et cetera. Kids can, so a child who gets SSI automatically has Medicaid. Kids can also qualify for Medicaid based on household size, household income, and their age. As you see up there, kids get broken down into 3 different age groups. So, it's possible that one of your children qualifies for Medicaid because they're younger and they're in that income limit. One of your children doesn't because they're older and they're not, and your household income isn't under that limit for the, for that older child. In that case, that child's going to qualify for CHIP, the Children's Health Insurance Program. So that's the second way kids can qualify for Medicaid. The third is based on a child having a serious health condition or a disability. Sometimes in Pennsylvania referred to as the Medicaid loophole category. It's actually coded in the system as a PH95 category. So that means it doesn't matter what the household, what the parent's income is, it's based on what's the child's medical condition. And when I say child, we're talking up to 18. This category of Medicaid eligibility ends at 18. So again, think, kind of covered that. So I've got SSI, I'm getting Medicaid, automatically. I'm getting some type of a check, some type in terms of the amount can vary, because the amount is determined by Social Security based on who else is in the household and what's their income. But as long as there's an SSI check being, that I'm receiving or a child's receiving, they've got Medicaid automatically. And again, that, in that case, that's Social Security determines a kid eligible for SSI up to the age of 18. Then at 18, Social Security, if that now 18-year-old is saying they're still disabled, now Social Security is going to review them under a whole different set of criteria because now they're an adult. Even though yesterday they were 17 and 364 days old, today they're 18, different set of criteria. And people, again, have to apply for Medicaid under this category. Get SSI, automatically get Medicaid. For kids with disabilities, again, household income doesn't count. It's all about what's the child's health condition or diagnosis or diagnoses, or disability. Getting documentation of that and providing that to the county assistance office, which is where, people apply, either online or with a paper or phone application. But, people apply, complete that application, and then in addition to providing standard things like copy of my child's Social Security card and verification of our address, providing verification of income, even though my income isn't going to count when looking at my child with a disability or a significant health issue. And then the really important piece, documentation of that health condition. That's the piece that the county needs to take a look at and review. Mary, hold your thought. Okay, we have a question in the room, but I'm gonna ask her to hold it so we can try to get through this. And again, this category of Medicaid eligibility ends at 18. Important to be keying into for, for families of children who are getting Medicaid under this category. And sometimes parents aren't sure. And we've got access to the Medicaid eligibility system. So, if you're somebody who's not certain, your child has Medicaid, your child's Medicaid health plan, if they're likely in one, but you're actually not positive what category that child's getting Medicaid under, and they're getting close to that 18-year mark, it's important to know that. And you can call you can certainly call the county assistance office. If you're not getting through because it's a tough system to get through and navigate sometimes, you can call our office just to ask us that, and then we can, help you understand, well, then what does this mean? if my child's getting it under the MAGI category versus the PH95 category? What, if anything, do I have to know or be concerned about, in particular, if we're looking at somebody who's going to turn 18 soon? Okay. So now what about Medicaid for somebody who's 18 or older? Again, lots of different categories that somebody, you know, might meet in order to be Medicaid eligible. Again, that SSI category doesn't matter my age. Doesn't matter that I'm the newborn, you know, or I'm the 99-year-old. If I'm getting a supplemental security income check, an SSI check, I've got Medicaid. They go hand in hand. As long as I have the first, I have the second. As Medicaid rules exist today and have for a long time. We always know anything can change, but that's been a constant for many years. That's still a constant. What if I'm 18 and older but not getting SSI? Well, you know, I could be eligible as an 18-year-old with a significant health issue or a disability under what's called a Healthy Horizons category that is based on having a disability. It's also the category for people who are 65 and older, don't need to have a disability. You're just 65 or older. You're a part of that category of Medicaid. And people also can be eligible 18 and older, actually starting at 16, for Medicaid under the Medical Assistance for Workers with Disabilities. And we're going to talk more about that in a couple minutes, that specific category. Kids can also receive Medicaid under what's called the Disabled Adult Child category, and this is tied to whether or not a child had, you know, had SSI and then lost that SSI because, for example, parent retired, drawing down their own Social Security benefit. Now my child's benefit, the SSI benefit, changed. They're not getting SSI. They're now getting a Social Security check based on my Social Security benefit. So it's a unique category, but one that, you know, we have helped many people over the years get Medicaid, or people who lost Medicaid, you know, only for us to help uncover for them, wait a minute, tell me more about this and that and when, and your child had SSI, and when was that, and when, and why did they lose it, and what, and when this certain set of scenario falls together, that child appears over income for Medicaid, but they're not, because they're a DAC, they're a disabled adult child. And then people also can get Medicaid if they're enrolled in a home and community-based waiver program, and we're going to talk a little bit about those. How do people apply for Medicaid? Lots of ways people can do that. However you apply, you're still having to provide, you know, various documentation. And again, depending on that category you're trying to meet, depends, you know, on the documentation. Sometimes medical records are key to get a child or an adult Medicaid. Sometimes they're totally irrelevant. There's no medical records needed because you just fit a category that doesn't have anything to do with the disability. And any time that piece is important, there's no open enrollment period, so to speak, for Medicaid. People can apply for Medicaid, and now with online Compass, literally 24/7, any day. There's no open enrollment, so to speak. Anytime you think you or your child's eligible. And when in doubt, apply. Everybody has the right to apply. The county assistance office has to process your application when you apply. Don't ever let somebody at the county assistance office ask you a few questions and say, yeah, you're not eligible. Chances are you probably should apply. We always screen people who are uninsured or underinsured for Medicaid. And we certainly are times that we tell people, I don't advise you to apply because you're a single adult and you are earning $80,000 a year. And you have $80,000 in savings. There's no scenario in that scenario that you're eligible for Medicaid. So, you know, again, I'd always let people know you always have a right to apply. My advice would be don't bother. because you're not eligible, which is why we screen people, because we don't send people in that direction when it doesn't make any sense. Once people have Medicaid, what do they get? What's the coverage look like? It's good coverage across the board. It's even better coverage for kids. Kids get, based on a federal law, EPSTD, Early Periodic Screening Diagnostic Treatment, is what that stands for. Kids who are, once they're on Medicaid, get an even broader benefit package. Kids get, things above and beyond even what adults get. And when we say kids, for Medicaid purposes, and that law that says there's quite a, breadth of benefits covered, kids are till they turn 21. So different than that Social Security piece. They don't line up, and that's confusing and causes problems sometimes for families. There's a difference between once I have Medicaid, then I'm looked at as a kid till I turn 21. Eligibility for Medicaid is different based on whether I'm turning 18 versus 19. So they're two separate things. There's Medicaid eligibility, then there's the benefit package after I've been determined Medicaid eligible. And those two for kids don't line up in terms of, well, wait a minute, I've talked to many, many parents over the years who said, my kid gets all these services, and I've been told all this time those services can continue, in-home nursing, behavioral health wraparound services. I've heard many times my kid can get those till they're 21. That's correct. That's about what benefits they have if they're Medicaid eligible. The Medicaid eligibility piece is separate. They may or may not still be eligible for Medicaid once they hit 18 or even 19. So two different things. And how do people get those benefits once they have Medicaid? There's three different now deliveries, what's considered a delivery system. I've got Medicaid, I've been approved, now what? And we certainly get those calls, that exact call. I applied for Medicaid for myself or my child or all of us, whoever it might be. How does this work now? What are my benefits? How do I go to the doctor? How does all this, work? Again, I'm going to start asking some more questions, and with the person's permission, I'm going to look them up in that Medicaid eligibility system. Very helpful. It's going to tell me things that that person who called me maybe doesn't even know yet. I'm asking them, does UPMC for you sound familiar? Yeah, I think that's the plan I picked. Yep, because that's what the system's telling me. You're in Medicaid or your child's in Medicaid, have a UPMC for you. And so that's the Health Choices managed care system. Different than somebody who accesses Medicaid with just their access card. Much smaller percentage of people across the state who get their Medicaid benefits through just the access card, but some people still do. Anybody here or on the phone has a child in the HIP program, the Health Insurance Premium Payment Program? And if your child's in it, generally for lots of other people it's foreign, don't even know what I'm talking about. If your child's in the HIP program, they're getting their Medicaid benefits with just their access card. And then some folks, the vast majority of Pennsylvanians get their Medicaid through a managed care system, either the Health Choices managed care system or the Community Health Choices managed care system. And that's as much as we're going to say about that topic. There could be an archived webinar at Achieva, just, I think, on Community Health Choices. Sure. Yep. Yeah. I'm sorry, folks on the phone. I have a question in the room, and I'm going to repeat it. Go ahead.
If you're applying for SSI and you're an 18, you're also eligible for Medicaid or otherwise.
So the question is, if I'm applying for SSI, Supplemental Security Income, through Social Security, as an 18-year-old, am I then also eligible for Medicaid? Again, some of it can depend on the scenario. So is this now 18-year-old, had they already been on Medicaid? Then possibly yes, by showing documentation that I now, or my parent on my behalf, as this now 18-year-old, has applied for Social Security. The county assistance office may also ask for some current medical records or documentation. And so yes, you could then get or continue to get Medicaid under what in that scenario would really be like presumptive eligibility category. But whether or not you're presumptive or any other way, if Medicaid's still saying for right now you have Medicaid, then you have Medicaid. That, being presumptive doesn't change anything about your benefits. So yes, that person could. Okay, so just a summary of the things that we've talked about. Okay, medical assistance for workers with disabilities. People often get confused about this and think it is something separate from Medicaid or different from Medicaid. It's just a way to get Medicaid. So it's a category of eligibility. So 5 of us could be on Medicaid. Somebody's on Medicaid because they're a child and they income qualify. Somebody's on Medicaid because they're a child. They don't income qualify. They qualify because of their health condition. Somebody's on Medicaid because they're 65 and older. Somebody's on Medicaid because they are on MAWD. They are somebody who is both working and has some type of disability or chronic health condition or serious health condition. So this category of Medicaid, like many, has specific criteria. For one, there's an age criteria. You can't have this category. You can't meet this category if you're under 16 or 65 and older. As the name implies, medical assistance for workers with disabilities, people have to have a serious health condition or disability and have to be doing some type of paid work. There's, and they don't have to be getting SSDI. The Security does not have to have determined them disabled to meet the criteria that says you're working and disabled. Must be working every month. It could be an hour or 2 a month. It could be work I'm doing for my neighbor, just so long as my neighbor's willing to say, yes, I employ Janice to walk my dogs twice a week, and I pay her $10 each week to do that. And that neighbor writes their name and their address and their phone number. Call me if you need to verify that, yes, Janice is doing this for me and I am paying her. That could be the work that meets the criteria, or any other kind of job, typical or, kind of more non-traditional. There's income and resource guidelines under this, and people do pay a premium. Unlike every other category of Medicaid, people do pay monthly and have to, or they'll lose the benefit under MAWD. Those are the income limits. MAWD only looks at you're either a household of 1 because you're single, or you're a household of 2 because you're married and living together. Doesn't matter if there's other people in the household, you have 1 child or 12, they're only looking at you and if you have a spouse in terms of income, and then looking at resources as well. Again, and so to be working, again, it can be, loosely defined. It could be something that's, just not typical traditional work. It may be something you're not doing right now, but you could be doing, or something that you're doing right now you're not getting paid to do, but maybe you could get paid to do. Maybe I take my neighbor to get groceries every week, and I just do that because she's lovely and we're neighbors. That doesn't mean she may not be able to pay me. I might take her every week if she could pay me $10 a month and verify that she's doing that in that letter. For purposes of this program, I'm working. I've met the work criteria. So again, it has to be monthly, it can be informal, and again, if you're on Social Security disability, Medicaid knows that. You don't even have to verify it. They've got access to the Social Security system to verify that, but you don't have to be on Social Security disability. You can be somebody who maybe very deliberately hasn't applied for Social Security disability. You have significant health conditions. You may be working full-time, part-time, whatever. you don't want to apply yet for Social Security disability. You're still trying to, despite some, health conditions, you're still trying to keep working. This category cannot require you. Medicaid can't require you to then apply for Social Security disability. You just need to provide medical records and documentation about what are those health conditions that you have to meet this worker for disability category. And we've kind of covered most of it. Okay. Apply for MAWD like you do any other way. There is actually a specific paper MAWD application. You don't have to use it. When we talk to people, unless they really want to hang up and apply online right away, I almost always mail them that MAWD application. It just helps flag for the county assistance office. They're either automatically going to know, oh, this person's clearly, they're not trying to get Medicaid because they're pregnant or they're this or that. They're trying to get Medicaid because they're working and disabled. Or it's going to have a worker that says, I don't know what this is, and hopefully gets it to a supervisor and says, what's this application? Okay. I'm sorry, we have a question in the room. We're going to. The question is, if somebody's working, informally, should they be earning, minimum wage? If for somebody who's working like an hour a month, let's say, I really encourage that. I said it's just kind of hard to make this, for this to seem legitimate if somebody's paying you 50 cents, for 1 hour of work. So in that scenario, I really encourage people, can you, especially if you're just working an hour or two a month, that they get paid minimum wage. That's not written in the rules anywhere, but it's a good rule of thumb. Now, again, if I'm doing something like, maybe I'm walking the dog once a week, but I'm getting $10 a month, that's fine. That isn't and shouldn't be questioned by the county assistance office. We have one more question. Yes. So in terms of the income counting rules, and that's true for other categories, primarily Healthy Horizons. Right, the way income is counted, this program, Medicaid, is so nuanced and complicated that it even gets down to, how, it isn't just what is my income, how's my income counted depending on what category I'm looking at. And so for MAWD as well as for Healthy Horizons, if I'm working, then they count less than, rule of thumb, it's half. They actually take your gross, subtract $65 and count half of that. Which again, it's why it's important to, kind of ask questions or call the Help Law Project, or because it can be confusing even just to, to see, somebody who's created a fact sheet that says, income eligibility for MAWD is, what did I say it was? It'll go up in the matter of the next week, $2,530 a month. That's your countable income. If all your income is from a job, you could be earning $5,000 a month gross and still be eligible. Your premium would be higher because your premium is based on your income. Okay. And here are some resources, including our MAWD guide. And our MAWD guide, that's just 3 or 4 pages long on our website, explains exactly what the person just asked about. And there are, there's actually like an example of our MAWD guide. So let's say you're getting Social Security and you're working, counting those different forms of income, totally different. Adding them together, then determine if you're under that income limit. Federal poverty levels almost always go up every year. When they do, it tends to be in the next month, end of January, beginning of February. So I just point that out, that these income limits that you're seeing today will likely change in a matter of weeks. Okay. And then home and community-based waiver services, the 4th topic that we wanted to talk about. What are they? Waivers are intended, kind of as the name implies, home and community-based. They are Medicaid programs. If I get approved for one of these waivers, if I didn't already have Medicaid, I also have Medicaid insurance. But the point of these programs is to help people with disabilities, various waivers, depending on people's health condition or disability or age, that help people get what they need in their home, in the community, who are otherwise probably have an institutional level of care and need. Without these services, I would likely need to be in a nursing home or some other, intermediate care kind of facility, based on my health conditions. So the whole point of these services is to help people be in their homes. And Pennsylvania is really working to move away from institutions across the board, whatever type of institution we're looking at, and helping people live safely and well and healthy in the community. Our numbers are starting to get better. Our Medicaid numbers are still pretty close, I think, to Medicaid dollars in a nursing home versus Medicaid dollars in the community, but we're moving what most people think is the right way. Less people in nursing home or institution, more people at home where the vast majority of us want to be. Our home, somebody's home. I got 2 daughters. I try to treat them well, So different waivers for people based on their disability, and these waivers, when I say these, the waivers that are tied to the state's Office of Long-Term Living, those waiver programs are all in flux, and they're going to be in flux until January of next year. And for people who have been, involved with or learning about or themselves in the Medicaid Community Health Choices program, that's, what this is tied to. So it made these slides tricky for me in terms of, because this looks different in Southwest PA, 14 counties as of 11 days ago, January 1, Southeast PA, 5 counties, rest of the state, that T-bone, what we refer to as the T-bone part of the state, their waiver programs look different than those other 19 counties do, because the state's moving these, not all waivers, really important to hear that, not all waivers. This is not tied to people who have an intellectual disability waiver or the autism waiver. This has to do with what are the Office of Long-Term Living waivers. The state's moving those programs into a managed care system. Already happened in Southwest in January of last year, happened January of this year in Southeast. The rest of the state is still on track for January of next year. So again, now when people call us, and we're looking at these waivers, I'm right away keying into what county do you live in. Makes a big difference. Where are you in the state? Where are you living, or where is your loved one or your child living? Because then how this plays out is going to look different, and what I'm going to explain to them and advise them about is going to look different depending on what county they're in until January of next year. So for people not in community health choices, then we're, with physical disabilities, then there are options: the attendant care waiver, the independence waiver, the OBRA waiver, some different criteria for each in terms of the clinical criteria. Financial criteria is the same across all the waivers. Generally, in these waivers, people have to be determined nursing facility clinically eligible. So again, the idea is my level of care is high enough that without the right supports in my home, in the community, I would need to be in a nursing home. But the idea is keeping you out of the nursing home. That's the point of the waivers. People start this application process through the state's independent enrollment broker, the entity the state has contracted with to help people, and determine them eligible and navigate them through what is generally about a 2-month or so process. Maximus is the agency currently that the state contracts with. they're the independent enrollment broker. And again, in 19 counties now, these waivers in name only don't exist anymore. They're now part of the managed care system called Community Health Choices. Then there are waiver programs for people with intellectual disabilities, autism, or developmental disabilities. Currently in Pennsylvania, we have 3 waivers, the community living waiver being the newest of the 3. There's been some changes to these waivers in terms of the eligibility. So there's no age limit for, for these waivers. If a child births to 8 doesn't necessarily have to have, for example, an autism diagnosis or an intellectual disability diagnosis. They could potentially have a high probability of, their current likely delays, developmental or cognitive intellectual delays. If it looks like by the time this child is 8, they're going to have an intellectual disability diagnosis, typically done by IQ. So you're not usually determining the IQ of a 2-year-old. The tests themselves aren't tailored to determine, the intelligence of a 2-year-old. So that's why now we have kind of this, kind of a grace period that, allows somebody to be eligible for. These waivers all have long waiting lists, unfortunately. These waivers do not currently. These waivers all have long waiting lists. And for these waivers, different from kind of that nursing facility criteria, clinical eligibility, you're looking at somebody who would likely require, what's considered an intermediate care facility. Again, over years, moving the whole system away from institutional-like settings and institutions and helping people live, thrive well in the community, in their own homes, in their families' homes, wherever that might be. People apply or start this process through your county office, through your county office of intellectual disability. Also have waivers for adults with autism, have to be 21 and older, have an autism diagnosis. Again, have to have significant functional limitations. So all of these waivers have clinical, maybe for lack of a better word, clinical criteria, in addition to having, income guidelines and resource guidelines. People interested in this waiver, who are 21 or getting close to 21 or 21 and older, this process starts through the Bureau of Autism Services. Go ahead.
I don't mean to steal your thunder, but now the ID waiver is covering individuals with autism.
Yes, it does.
Which is huge.
Yes, absolutely, it is huge. And on there, no age limit for individuals with autism or intellectual. No. So the comment was just that the intellectual disability waivers now, and this had not been the case, also covers individuals with an autism diagnosis who don't have to have an intellectual disability diagnosis. So I can have an autism diagnosis, but my IQ might be 100. I don't meet that clinical criteria for having an intellectual disability, but I do have autism. And again, looking at other criteria as well. I have autism and generally have, a fair amount of needs still, as opposed to somebody with autism who's, really doesn't have a lot of needs and really doesn't need this level of support, the level of support people can get through these waivers. Again, waiting lists, interest lists, the Bureau of Autism calls it. Older adults, and waiver programs specifically for them. Again, depending on what county you live in, the aging waiver does or doesn't still quite exist. In name only, it's gone. The benefits are still here. It's just in a managed care system. But the eligibility process is still the same, and the eligibility criteria is still the same. to get these services, whether I'm getting them directly through the state through a waiver program, or I'm getting them because the state's paying a managed care plan, and the managed care plan is delivering these services for me, getting any of these services, that criteria hasn't changed. So I still have to have a certain level of care, and my income and resources have to be within the guidelines. So income limit for the waivers, and that is the 2019 income limit. That limit, we do know, went up a little. It was $2,250 last year, so it's $2,313 for 2019, and looks at the income of the applicant only. So we're not looking at parents in the case of, you know, a child, and we're not looking at spouse in the case of, you know, an applicant who's married. For income purposes, different for resources, but for income purposes, if I'm the person applying for the waiver, they're just concerned about my income. But then they're concerned about resources, you know, across the board. Mine, in my name, spouse, spouse's name, anything we have collective. It's all going to be looked at to determine whether or not, you know, I'm under that resource limit. Then if somebody is determined clinically and financially eligible for any of these waiver programs, then once they're determined eligible, and that's kind of a system, you know, that system is separate from, you know, then, okay, you know, I've been determined eligible, now what? Now what services do I get? Depending on the waiver, the services can vary, and what services I get are all tied to my service plan. They call it something different in the ID and autism waivers than they do in the other OLTL waivers, but bottom line is it's still a service plan. It's still about somebody, a service coordinator or a supports coordinator, meeting with me face-to-face, and whoever else I want to be a part of this planning and conversation to look at what are my needs, what are my wants, what are my goals, what services are a part of this particular waiver I've been approved for that can help me meet my needs and my goals. Okay. Different waivers have different services. So this is, you know, this is just general picture of what's covered. Just a note that somebody could be over the income limit for waivers or even a little over the resource limit for waivers, but if they're within the income and resource limit for MAWD and meet the clinical criteria for waiver, it's almost like a backdoor way to get a waiver for somebody who's otherwise either slightly over resources or they're over income. And in part because, as we pointed out earlier, MAWD counts income differently. Waiver strictly looks at what is your gross income, period. Gross monthly amount with no disregards whatsoever. It is exactly what it is. So MAWD can kind of be a backdoor way. There are people who are getting waiver services because they're MAWD eligible, which obviously means they're doing some work, some type of paid work. Some resources, including our helpline. Please don't hesitate to call, and folks have my direct line, have my email, and then you have our helpline, because we covered a lot of material in a short period of time. Patty, just take questions or move. Move to.
I have two questions unrelated to one another. First question is about MAWD. Could an adult who is living with Parkinson's and deteriorating, so currently working, but expecting to deteriorate, could that person apply for benefits through MAWD, you know, presently working regular jobs and not yet retiring? Is that something that could potentially be an eligibility?
Right. So the question is, somebody who's currently, you know, has Parkinson's, is working. The Parkinson's is unfortunately expected to get worse, to deteriorate. You know, could that person apply now for MAWD? Sure. If that person is, and again, like in the case of somebody calling our helpline, you know, we would ask them, you know, we would screen them for eligibility. So as not to send them down a path that isn't going to make sense. So, you know, if that individual, you know, has savings or an IRA or a 403, you know, any type of resource, liquid, or could become liquid, even if it costs me money to draw it down early kind of asset, if it's over $10,000, the person's not, they're over-resources. So unless somebody's at a place where, well, yeah, I'm slightly over-resources, but, you know, I got a car I could pay off, and they want to do that. We never give people financial advice. But, you know, so again, it's so individualized depending on a person's scenario. But somebody who's in that position under 65, working, you know, with a, you know, even despite the disabling condition, could probably meet the clinical criteria, but if they've got $50,000 in savings, then they're not MAWD eligible. So, but that person, if they're within the income resource limit and look like they're also clinically eligible, as you said, they're not getting Social Security disability and right now don't want to. They are still working and want to keep working. You know, as long as they meet all that criteria, absolutely, they could apply for MAWD now, you know, if that made sense. If they have insurance right now that's really good, with very minimal cost, why add the MAWD? Because you have to pay for the MAWD. If what they have now, you know, has a deductible, has any number of things that make it well worth it to pay what might be, you know, a $50 a month or a $150 a month premium based on their income.
My other question is not related to that, but if there is an individual who currently has a waiver and is receiving services, but maybe needs, you know, family or service provider, well, I guess service providers will know. Let's say family doesn't know, yeah, this person gets services. How do they find out which waiver?
Okay, so the question is, if somebody's on a waiver right now, but they're not clear which waiver they're in, they should absolutely be asking their service coordinator or their supports coordinator. They call them different things in the different systems. Yeah, and it would be very problematic in my view as an advocate if that service coordinator or supports coordinator did not know which waiver they were in when they were my supports coordinator. But again, that information is on the Medicaid eligibility verification system, so, you know, somebody could call our helpline and I could look that information up in about 90 seconds.
Thank you very much.
Yes, and absolutely, and we don't, yep. So we're going to just take one more question in the room, and then I certainly can stay later. I don't want to, right. Okay, go ahead.
I have a question regarding MAWD. For those who are getting paid to walk a dog or something, the person paying them writes the letter. Do they need to report their income every month to Social Security, or how do they do that?
The person who's, so the question is about somebody who's on MAWD who's doing informal work, so not a job where taxes are already, you know, being taken out. So does that person on MAWD getting paid whatever amount, you know, in a check or in cash with no taxes coming out, do they have to report that income? That's an IRS question. I mean, legally, technically, it's an IRS question. Do people do things every day, adults and kids? Are babysitters reporting their income? Does my dog sitters report their income? Quite honestly, that's, you know, I mean, people do lots of things, but again, I'm not working for the IRS, nor am I encouraging anybody to not report their income. Exactly. That's the important question, I think. For the purposes of getting or keeping MAWD, does the state or the county assistance office require that and show proof that I am reporting that income? No, they do not. And depending on what people's total income is, there may be nothing to report. There are people who, again, can't answer it for you because it's not my expertise, but there are people who have earnings from Social Security or whatever sources. Not everybody has to file taxes. It is tied, I believe, to your income. So, you know, again, maybe somebody who's on Social Security getting, you know, $800 a month and doing some work that they're making $50 a month, I don't know that that person even has to file taxes, period. They may. I literally truly don't know. So, but no, Medicaid's not requiring proof that you're reporting that to the IRS. I'm not concerned. All right, thank you so much. Yep, absolutely, absolutely.
Thank you, Janice. I learned a few things, too. I'm Elaine Cole. I'm the Public Affairs Specialist for the Social Security Administration out of Western Pennsylvania and West Virginia. I have a really soft spot for Pennsylvania because we have better casinos than West Virginia. So, first of all, I'm going to quickly go over eligibility factors, but I want you to be able to relate to those eligibility factors for the different programs that Social Security administers. So it's going to be about who, what, when, where, and how you can get these services from Social Security. So when you're looking at Social Security, you're looking at what we administer. And we administer retirement benefits, we administer disability benefits, and please keep in mind disability benefits also lend to how we pay you. It could be that you're receiving SSDI, which is an acronym for Social Security Disability, meaning that your wages are paying into a system that is considered that you are insured. And I always like to give this example. When you have a car and you pay your car insurance, you have coverage, correct? Well, if you're working, you're paying 6.2% of your wages, and that is your premium. But if you stop working, what do you think will happen? No coverage. So it's the same principle. Whenever you're looking at SSDI and you're working and you find out that you're unable to work because you have a condition or an illness that is preventing you from working for at least 1 year, that's when you should be applying for SSDI, because it is causing you to not be able to work to the standard that you have then. On the other hand, the person that does not have a work history or a very limited work history, that person may qualify for what we call supplemental security income. As Janice has just gone over, that is a needs-based program similar to welfare. But this is for the person that may be disabled, that may be blind, that may be a child, that may be a senior of the age of 65 or older, that qualifies for this SSI program. There are no wages attached to the SSI program to be qualified. You have a question?
I have a question. He just turned 18, so we're new to the Social Security. We applied. And this is the part I don't understand. Okay, he's eligible for the Social Security, so we did get it, but they deduct what they consider other income. They deduct $275
Absolutely.
How do they determine that amount, and how do they determine that? Because I thought once he was, like, he didn't get it because, I guess, when it was based on our income or whatever. But the part that kind of threw me is, like, we're basically living on one income because I only make about $7,000 a year part-time because I only work when he's in school.
Okay.
So how do they
The question is, just in summary, that I have a child, is on SSI, they're not receiving the entire $771, which is the maximum rate that you can receive on SSI. However, the check that the child is receiving is lower than at $771, and the explanation in the letter that you're receiving is based on food and shelter. So therefore, when we're looking at SSI, we're looking at, are their needs being met and are they paying their fair share in that household? So in your particular case, I'm assuming that your child is living with you.
Yes, and he wouldn't be able to live by himself anyway.
Okay. When the child is living with you, we're looking at, are they paying towards the mortgage, towards the rent? Are they having all of their meals at home? Are you expecting that they're paying for the gas, the light? Any bills that are coming into that household, is that particular child paying their fair share? There are two different types of living arrangements. If we determine that this child is paying their fair share of that household, it is considered an A as an apple type of living arrangement. If they are being supported by others in the household, meaning that you're not expecting the amount that is necessary for them to pay their fair share, they're considered a B as in boy household. So therefore, we take that amount, and I'm not familiar with the exact rate, but it would be in the supplemental security income brochure that's here. And usually it's around $250, $265 that will be subtracted from that $771, and therefore that's why your child is deemed living in a B living arrangement. So if you want to call our local office or call the 800 number, they will give you guidance as for whatever you said in the application process about the living arrangement. If something has changed, then they will requalify your child. And if they find that that child is paying their fair share, they will raise it to the $771. But if you come back with the same answers that you did on that initial continuing report, then it will remain the same.
It was based on what I said whenever I was being.
That's correct.
It was a total disaster because I was set up for an appointment and he wasn't even eligible. The office set me up for an appointment and sent me there, and I guess I was supposed to wait a month after he turned 18. So the girl did fill out the application that day and apply, even though he wasn't eligible for like a month. Later, I was there for like 2 hours. So I don't know, whether
That's why you would need to contact the local office, go over but what we're going to do is ask you, how much are you expecting him to pay towards your mortgage or your rent? How much is, you'll have to provide the bills that are coming to the household and how much that child is contributing to that particular situation. But we're not going to give you what your answers were before. We're going to ask you directly what's happening now. And so we can determine if he's paying his fair share of that household. Okay? Yes, sir.
Do a room and board agreement in order to establish that amount?
Yes, you would. What you would need to do, whenever we take the initial application, and then if you have been deemed that it was an approved application, we're going to call the person in and also the person that person is living with, and we're going to ask them to provide us a letter, or we'll give you a form that you're actually putting down that, yes, I'm expecting that there's $200 in rent every month. All the meals are being prepared by myself, and that person is not having any outside meals, because that all counts. If there's gas, light, making sure that they're paying their fair share for that. At that point, once we are able to determine if the household and the household bills are actually the fair market value, then we'll make a determination if it's an A or B living arrangement.
Is there a later accounting follow-up on that to establish that the money was spent as representative payee on the support of the individual?
Whenever any of our benefits that are disability, either SSDI, retirement, survivors, if you have a representative payee that is in charge of someone else's benefit, which is the representative payee program, then we are going to send you a document every year explaining that for 12 months you received X amount of dollars, and we're asking how did you spend those particular funds. Either it's food and shelter, the next category is clothing or extra expenses, like for instance, you may have purchased a computer for that particular applicant, or you may have saved it all. But in that case, your bank statements or the statements from that institution that is holding that particular money would provide that for you, so you could put that in that information. But when you're with organizations like Achieva, they are able to provide you with information on how to set up trust funds, that if you have a child that is on SSI, they will not have to be responsible for what's in that trust fund. So their benefits would continue. And that is very, very good for that person that is looking towards the future for their disabled adult child, or even for their child, that they're looking at, I'm not going to be here always, but I have something available in which will sustain my child even after I'm gone. And that's what's excellent about Achieva.
Yes. Now, there's certain, I did learn about that, and in there, when I asked questions about that, I was going to try to start that because it's 18 now, and see if I can maybe start something for that, and they said that they'll take money like every year. Like if you put like say you put $2,000 in, they take like money and they'll just eat away the money unless it's going to be used. If you wait till like a certain age.
Well, I'm going to let Achieva speak with you after this seminar, so you will have more direction on how to handle that. But the bottom line is there's options available, especially if you're doing future planning. But for the SSI purpose of this discussion, it is very important that you keep the assets below $2,000, because if you go over that, then that's whenever your particular benefits will be suspended until they are spent down. And there's very specific information that has to show how that particular amount has been spent down. You can't just give it away.
I'd be glad to talk to you after the program.
Okay. All right. When we are looking at an individual and you have come to our office or you've gone on our website, socialsecurity.gov, and you may have applied, or you may have gone to an agency and received support in which to apply for a benefit, the bottom line is make sure that the information that we have is complete. You're telling a story, especially with disability, regardless if it's SSDI or SSI or it's a disabled adult child. When you are doing that initial phase, you're telling a story. The beginning of the story is, these are the conditions that I'm having. And they started not necessarily when you stop working. They may have started several years ago because you've been able to continue working with that condition. But now that condition has become that it's inhibiting you from doing what you usually do. So therefore, excuse me. So therefore, what you're going to do is say, okay, these are my conditions. This is when this particular condition has stopped me from working. But I had this condition from years ago. I went to the doctor, the doctor's names, the hospital's names, even if you had blood tests. You want to put down all of these details. We suggest that you do this online, the medical portion. Why? Because you may sit down and say, you know what, I'm missing some things. You can save that particular application. Come back to it. You have at least 90 days to come back to it so that Social Security can say, do you still want to apply? But if you just go right through it and just give us sketchy details, when we look at this information, we're going to send it on to Greensburg. That's who does our determination. The Department of Determinations is located in Greensburg. They look at this medical evidence. Now, you may have indicated that you have a developmental delay, and that is proven when you were a child. But now you've turned 18. But maybe that developmental delay is not going to really inhibit you from working. You didn't tell us about that you have cerebral palsy, that you have a type of cancer, that you are living with other conditions that should have been on that particular document. So therefore, it goes to Greensburg. Greensburg looks at it, and they say, yes, they had a developmental delay, but they had support services while they were in school. At this point right now, based on the cognitive tests that have been run on this particular person, everything's fine. It's been denied. When you get that denial, make sure that you appeal it within 60 days. You'll have time to get some things together because it's going to take about 2 years for the administrative law judge in which to discuss your particular case. Well, when you're looking at your information, you've noticed that you've left out some very important details. At that point, we're already in the appeal phase. However, you want to provide that information either to the local office or you're going to get information that your appeal is sitting down with our administrative law judge. You want to get those records over to them as soon as possible. Because if they find out that there has been some misinformation, that there's no need to wait for 2 years, they can remand that back to the Department of Determination for them to determine the existing information that has been provided needs to be looked at again, and a different decision needs to be rendered. But these are things that you could just stop by just providing us the whole story. Take your time. When you make an appointment with the local Social Security office, as she was just saying, it was almost 2 hours that she was sitting in the office. But if some of that information was already taken care of before she got into the office, she could have remembered there's additional details that I needed to provide. I'm going to take this window of 2 hours to make sure that Social Security has that information, but I thought about it when I was at home putting this information on my computer, okay? Online is giving you that opportunity to tell your whole story, to write your book. So if you're not taking that additional time, that's why a lot of people are denied on the first try. If you have this particular paper, the fact sheet, and for those of you that are on the phone, this fact sheet can be found on our website, socialsecurity.gov, and a lot of information is contained on this one sheet. First of all, when we were talking about taxes, then we're looking at that the employee rate is 7.65%. It has not changed. 6.2% of that particular tax rate that they're taking out of your wages is actually what goes directly to the Social Security Trust Fund. That additional 1.45% tax is Medicare. And if you remember, Janice was talking about it gets very confusing. Why do you have to come to Social Security to get to Medicare? Well, from birth, now, you get your Social Security number. To the grave, you still have that same Social Security number. Even afterwards, you will have that Social Security number. Why? Because if there's a family that you have left behind and there's survivor benefit, that Social Security number is going to get them paid, okay? So the logical steps are that you come to Social Security. Do I qualify? We're the who. I'm coming to Social Security. Do I qualify for benefits? Let's pull up your Social Security number and look at your work history. Either you have 10 years or 40 quarters posted to your record, and that's what's going to provide you retirement benefits at the age of 62. But I'm a younger worker. I want to know if I can get disability. We're going to pull up your Social Security number. We're going to determine if you, out of the last 5 years, if you've had 20 quarters, if you're over the age of 31. If you do not have 20 quarters out of the last 5 years, then we're going to immediately look at a different program for you. That program, SSI. Do you have assets more than $2,000? No, I don't. So therefore, I can go to that next step, in which for the Department of Determinations in Greensburg will decide if I have a medical condition that is enough to approve that particular application. Does everybody follow that? I know I'm taking you fast, but these are the basics. So Once we do that, again, do you have any children? Yes, I do. That's still going on my Social Security application. Regardless if it's an SSI program, if it's an SSDI program, if it's a retirement program, and also because of my retirement or my disability application, even after I'm gone, I recognize that I had children. I recognize that I had a spouse. All of that is still on my Social Security application. I'm 65. I worked all my life. What do you mean that I do not have enough work history? The question you should be asking, did you pay taxes? Did you pay your 6.2%? Or did you work under the table? That's why several people will come into our office. They're expecting to get retirement benefits. They do not qualify because they did not have at least 10 years or 40 quarters, or they have not been working. If they wanted disability, for how many years prior to the disability? 5 years. Are they insured? I would like to file for Medicare Part A. I'm still working. I'm covered under a group health plan. Very good. Where do we go? The Social Security number. Do you have 10 years or 40 quarters? Yes, you do. You can get Part A for free. And this is why it's important that your records are accurate, because we're always going to your Social Security number. We're always looking at your history, making sure that you're eligible for the benefit. Now, the next step is finding out when and where that you are supposed to do this. If it's disability, more likely you're not making substantial gainful activity on the back of this fact sheet. Meaning, for 2019, you're non-blind. The amount is $1,220 that you can still earn and apply for disability. If you are approved and your particular earnings continue to keep dropping but you're still working, we're going to even give you a trial work period. Does everybody see that? The $880. So you've been approved for SSDI. That has to do with wages, correct? So we're looking at this information and we're saying, you have a trial work period. I'm not able to make $1,220. However, I'm making about $900 a month. So in that particular case, you're going to get 9 months that you're going to be able to make at least $880 and still receive your Social Security benefit. So you might be receiving $1,000 a month from Social Security, and your particular work is at least $900. So together, $1,900 of income is coming in, and it's not affecting your Social Security because you have 9 months that you can earn at least $880. But the following month, my condition is really causing me some issues. So my particular earnings have gone below $880. We're not going to count that. So it could be in the month of January, yes, I made $900 a month. But the month of February, I may have only earned $400. I just have one trial work period, and that trial work period is giving me at least 9 months that I can earn over $880. So if it's not consecutive, Social Security doesn't care. However, we're still counting 9 months for over 3 years. So if you don't work again at the $880 from now, and now we're in 2020, you still only have 1 month that is considered a trial work period month. Does everybody follow that? So when you're looking at, I have disability, regardless of the program, we're trying to tell you that you can work. You have the choice of working. If you feel good and you're able to, even with your condition, still contribute, you're allowed to work. There's just certain guidelines that you have to follow and still be able to continue working. In addition to that, we talked about that the SSI person gets a maximum of $771. If we have a couple that is on SSI, then they are permitted to receive $1,157 from Social Security. If an individual has an asset over $2,000, what do you think is going to happen to their SSI? It'll stop. It will stop because now the need is not there. We're looking at that you have $2,000 or more as an asset, so that's why your SSI will stop. As a couple, that amount is $3,000. Now, when you're looking, they also provide you what the student limits are. A lot of times, if that particular child is going to college after they're 18, there's also monthly limits that are available differently for that particular child.
That's an income limit?
That is if they have assets of more than $1,870, that could be employment wages. It could be that they're getting stipends. We have to know about that income when it's SSI. Yes.
We have a disabled adult child.
Okay.
That's totally different.
Not necessarily.
And what's the monthly and the asset?
Okay. When you have a disabled adult child, then that is tied to usually someone's employment history, the father. Okay. In that particular case, then if they're working, we still need to know what their particular work earnings may be. Because going back to that trial work period, going back to what we call substantial gainful activity, if they are at those particular limits, then we're going to be looking at, do they really need the disability benefit they're receiving from the parent? So therefore, if that particular child is not at those particular limits, then there is nothing to have for a disabled adult child.
The 880?
Pardon me?
880?
The 880 is the trial work period that you get of 9 months. And then as for non-blind, then it goes to $1,220 once you're out of the trial work period. Are we good, or?
Is there a total asset?
Not whenever it's coming from a parent. They could have $1 million in assets. We don't care. But if they were on SSI, then that's whenever we're looking at how much they're earning, which is they cannot have more than $2,000 in assets. Okay? Does that answer your question? Okay. So when we're looking at this information, we're looking at a choice. We know that if we go to the front page of this fact sheet, and if I'm working and I want to know if I can get quarters of coverage. And if you notice, they talk about maximum taxable earnings in the center of the page. And then the next category is quarter of coverage. And that amount is $1,360 for 2019. For those of you in the room, does everybody see that? $1,360. So that is telling me from January through March, as long as I actually earn $1,360, I will get credit for 1 quarter for 2019. This is really important for that person that is on SSI. They decided to work, but they're making a very small amount, but they're still getting credit as long as within that 3-month period they have $1,360 in gross earnings. As time progresses with that person, if they're slow and steady, they may be eligible for SSDI based on their work history, even though they're on SSI. So I have a particular child that is actually working. They're making about $6,000 a year, which, if you notice, that would qualify them for at least 4 quarters this year. And at this point, they're on SSI. They're under the age of 22. They receive the information that they do qualify for SSI. Now they've worked for 1.5 to 2 years, still at $6,000 a year. At the end of that second year, we have already attached at least 6 quarters to that person's record. Their Social Security number has that work history. Now they may qualify for SSDI on their own merit. It's not going to be a very large amount, but there's something payable from the SSDI program. So that person may be receiving $300 from Social Security, and the additional $471, as long as they're in a living arrangement of A, will come from the SSI program. And because they are actually working, Congress has instituted, they will give them an additional $20 for working. So they are actually receiving $791 plus the $22.10 that the Commonwealth provides as a supplement. Yes.
In that scenario, then, if it's that way, for say the next 24-month period where I'm getting those SSDI checks, then am I going to get Medicare on top of that
good question. When you qualify for disability, remember, if you take it on the initial, we're looking at what was the first month that you were actually eligible for your payment. It could have been that your onset was back in January, meaning that you said to us, we became disabled in January of 2018. Remember, with SSDI, there's a 5-month waiting period. So therefore, from January through May, that is your waiting period. You don't become eligible until the month of June. So therefore, June becomes that first month that is counted towards that 2 years of waiting for Medicare. You're still earning money and you're still receiving SSI, so that means that your Medicaid would continue. $300 from SSDI, $471 or whatever it may be from SSI. As long as you're receiving $1 from SSI, your Medicaid would automatically continue. But for the person that is being switched from SSI to SSDI, because their particular earnings are much above the 771, they're receiving $800 from SSDI, their SSI stops. We give them the phone number to the Apprise program, which Janice mentioned, at 412-661-1438. Because they're not receiving SSI, their Medicaid is going to stop. Now they need to know what their health care options are. And that's where Social Security is instructed to send that particular beneficiary. So therefore, once you stop receiving SSI, at least $1 you have to receive for Medicaid to automatically continue. But once that stops, now we're going to start counting 24 months from the day that you were eligible to receive a check. Yes?
I have a question. My son received a check. I thought it was SSP or something. It was a check for like $25, and it was a separate check, and I didn't know what it was. What is that?
That's something from the state of Pennsylvania. That's the supplement that I was talking about from the Commonwealth, and it's usually $22.10.
Yeah, it was around that, yeah. I just didn't know what it was. It became separate.
Right, because the state administers that part of the program. We do the federal rate, which is the larger portion of the check, which is the $771. Okay? Yes.
You mentioned the Department of Determinations in Greensburg. Is that the same as the PA Department of Labor and Industry?
They are still a state agency, but they're totally different.
Well, don't they make the determinations, though, for Social Security?
Not the Pennsylvania Department of Labor.
That's what they told me.
They are still under the Commonwealth. Each state has Department of Determination services, and what the federally, we pay the state for the medical examiners of that particular agency to give us the determination. All they do is strictly medical information. Now, the Pennsylvania Department of Labor, they do a lot with medical claims, especially workers' compensation. However, that is federally funded with only the Department of Determinations, which is totally separate than the Department of Labor.
When I filed for SSI for my son, somebody from the Pennsylvania Department of Labor and Industry in Greensburg called me and said they were making the determination on behalf of the SSA.
Each state has something different, but as for how we federally pay them, they're two separate entities. It might be under one agency, but as far as we're concerned, the Department of Determinations is funded by the federal government. Okay. All right, that sums it up, and I know it's probably lunchtime for a lot of you. I'm going to be here a few moments. I do have a meeting with the Chiva that I do have to go to. However, I hope that this has been helpful in just getting a little bit about the basic principles of Social Security. If you don't get anything else, please remember you have a choice and there's options available. Each person is different because each work history is different, but what we have in common is that we all have Social Security numbers. Thank you.
Thank you. Thank you. Thank you, Janice. Thank you, everyone. Don't stay for a couple minutes, but if anyone has questions that we at Achieva can help you with, I'll be here. And if you want to email me, I think you all have my contact information for further questions or Janice or anything, please let me know. And don't forget to do your survey if you have a minute.